tell us a little bit about your experience with memory care and what you do.
So I am a nurse practitioner, and instead of working in a clinical setting, I go into people's homes and to assisted living facilities and do visits with patients in their homes or in their facilities, so they don't have to go out and see the doctor in a facility. I like this because I get a truer sense of what's going on with the patient. A lot of times, if they go to a physician's office and if they have any type of Alzheimer's or dementia or other issues, they're more anxious, more nervous. They're not their true selves, and so the physician doesn't always get a true sense of what's going on with the patient. When I see them in their home setting, whether it be in an assisted living facility or at home, I can better understand what's going on with the patient and see what's causing their concerns or issues, and it seems to be a little more helpful that way. My experience with assisted living facilities has been a really positive experience. I feel like once residents reach a certain point in their needs, for families to care for them, they should go to an assisted living facility to have those cares met, so that the patient is, can continue to be their family member and not a patient to them. It allows them to maintain those relationships. For the residents or the patients, it allows them to maintain their dignity, so their family members aren't having to do cares and different things that would be embarrassing for them or for the patient. And they usually have a little more socialization at home. Their families have a lot going on, and so it's hard for them to have the same amount of socialization and interactions as in a facility. There's people that is their job, is to provide social activities, get them involved in doing some type of simple exercise program or different things, and it really makes a big difference for their overall health. I've seen over the years patients that come into a facility, if I do their initial lab work when they first come in, usually the levels are usually off by quite a bit. Within 2 to 3 months of being in an assisted living facility, normally their labs are back to normal because they're getting good nutrition, good hydration, exercise, medications are being managed by the facility, so they're being taken correctly. And so normally we see all of those normalize or improve within 2 to 3 months of being back in an assisted living facility. So I think it's a great thing. For the older generations, it's a hard thing for them to leave their homes that they worked really hard for. But, the families, if they can be positive about it and help them understand the benefit of doing it, it certainly is good for them.
That's awesome. Thank you so much. I learned something too there. And I have seen you in action here in our facility, sharing all that with families. And I love that the families can come and we arrange the time that you're going to be here and they get to talk to you too. I find that so helpful. You are very easy to talk to and explain things so well. So I think you have blessed so many families' lives here, and we are just grateful that we can have you come in. I feel like there's nothing really that I could ask you that you kind of aren't an expert on, Brent. So let's just start with maybe hydration. How do you feel about hydration? Typically this time of year, it's so important. It's getting hotter out, but it's kind of a problem across the board with dementia and the elderly anyway. What are your thoughts?
Yeah, hydration is difficult because if the patients aren't moving a lot and doing a lot of things, they don't necessarily feel thirsty or they don't get that thirst sensation, but they still need a certain amount of fluids. Also, especially with Alzheimer's and dementia, they forget to drink fluids. and it can cause a lot of different problems. It can cause urinary tract infections, weakness, fatigue, a lot of different issues. And in especially assisted living facilities, there are trained staff that are trained when they do safety checks on the patients, when they're giving them their meals. They're trained to prompt the patient or remind the patient to take a drink, or they hand them a cup, those types of things, and then they naturally will take one drink at least. And so it takes that prompting, it takes reminders, and it takes just handing them that cup to do it. And they don't always get it at home because everybody's busy that's helping care for them, or they live at home by themselves and they just plain forget. Some elderly also will avoid drinking fluids because they don't want to have to run to the bathroom so many times. It's one of those things they don't like to talk about. It's embarrassing, but a lot of them they won't drink water on purpose because they feel like they're spending too much time in the bathroom. But working with them on managing a schedule to go in and go to the bathroom, and certain medications, they can make it so it's not a problem for them and so that they can drink the fluids and feel comfortable doing that.
Thank you so much. There definitely is a lot of stages to this, and I found that you're very good at explaining the stages to the families. Do you want to just share a little bit about what you know on the stages of dementia? The biggest mistake people make with dementia, they always have a hard time knowing, do they have Alzheimer's or do they have dementia? And they don't know what the difference is between the two. And the Alzheimer's is a disease process, and dementia is a symptom of that disease. So dementia can be related to head trauma, a stroke, any Parkinson's. And once it gets to a point where that disease, Alzheimer's included, affects their mobility, their cognition, their comprehension, their ability to function and perform their own daily cares. Once it gets to that point, then they classify it as dementia. So they would say a Parkinson's type dementia, Alzheimer's type dementia, vascular dementia if it was from a stroke, and that's just if it's affected speech, mobility, and cognition and comprehension, then it's classified as dementia, but it's usually based on one type of disease like Alzheimer's or something. Typically, it's slow and progressive. From 3 to 7 years is a fairly typical progress from Alzheimer's to full stage of dementia. Most people die within 7 years of their initial diagnosis of Alzheimer's or dementia. That's not to say they couldn't live longer, but that's fairly average. At least 90% of patients pass away within 7 years of being diagnosed with dementia. Thank you so much. Clearly, we need to hear more from you, and we will do just that. So thank you for sharing your time with us today.